Hello, everyone. Thanks so much for attending the American Diabetes Association's first ever Brown Bag Lunch series for school nurses. We're so happy you're here, and we so appreciate everything you do for children with diabetes to keep them healthy and safe at school. Today, we're going to focus on legal protections for students with diabetes. I'm Crystal Woodward. I'm the managing director of our legal advocacy division at the American Diabetes Association. I have been with the association for almost 3 decades, leading the Safe at School campaign. And I also have a now grown daughter with type 1 diabetes who was diagnosed in 1991 with type 1 at the tender age of 1 year old. And I always like to tell the story about um, how my daughter is now an ICU critical care nurse because of the influences and positive experiences she had with her own school nurse growing up. So thank you for all you do. So let's get on with the program. I'm going to fly through the content because we only have a half hour and I want you to have time to answer questions. So please put your questions in the chat. And at the end, I'll go through the chat and answer as many questions as possible. And if I don't have the answer, I will go digging for the answer and get back to you. So here we go. The association, of course, we attempt to ensure that all the information is accurate and current, but this is general information about potential legal protections and medical best practice. It's not a substitute for individualized legal or expert advice. So we encourage you to go seek out a medical professional or a legal professional if you do have questions or are seeking representation. At the American Diabetes Association, there are 3 pillars to our mission: to cure diabetes. We are always searching for that cure, supporting increased research funding, and doing all we can to make sure we are supporting the best and the brightest scientists and institutions to find a cure for diabetes. Also, to prevent diabetes. We know this is especially important with the rising incidence of type 2 diabetes and type 1 in children. And the third pillar, which is what I'm focusing on today, is to improve the lives of those with diabetes and affected by diabetes. And this includes children, adolescents, and young adults in the school and daycare settings. Just some quick stats about diabetes. There are about 352,000 Americans under the age of 20 who have diabetes. So just to give you some perspective there. Our Safe at School campaign, which was launched at the association almost 30 years ago, is grounded in 3 principles. And those are that all school staff members who have custodial responsibility or interface with students with diabetes need to have basic knowledge about diabetes, such as what does hypoglycemia look like and what do I do if one of my students, or I see a student who is demonstrating symptoms of low blood sugar. Do I grab a juice box? Who do I call for help? The second principle is the school nurse is the primary provider of diabetes care in the school setting and the key coordinator of care. But unfortunately, not all schools have a full-time school nurse, as you know all too well. So we must always make sure, as state law permits, that other school staff have been trained to provide needed diabetes care to students in accordance with their diabetes medical management plan or their provider's orders. And then last, capable students should be permitted to self-manage their diabetes anywhere, anytime, whether it's the classroom, the gymnasium, on a field trip. And these principles are supported by these organizations. So what do we know about the provision of diabetes care at school and the need to provide diabetes care at school? So we know diabetes care is 24/7. Our kids don't get a break when they get on that school bus in the morning. It's constant. So students with diabetes cannot take a break. The goal is a smooth transition from home to school, but we do acknowledge and understand that the diabetes care provided at home may look a little different at school. Students must have access to their equipment, medication, and assistance from a school nurse or a trained non-clinical school staff member. Fluctuating or out of range blood glucose levels may negatively impact learning and behavior. We know that if our kids are taking a spelling or a math test or engaging in a classroom activity, if their BGs are high or low, they're not feeling good. So they're not going to be best positioned to perform. So we know those blood glucose levels have a huge impact on student success and performance. And written care plans are essential, such as the DMMP, Section 504, the IHP, IEP, or other written accommodations plans. So what are the goals? The goal is to provide a medically and safe environment for students with diabetes. And as a school nurse, your role is so critical in the provision of this medically safe environment. Students with diabetes must have the same access to educational activities and school-related activities as their peers, including after-school activities, going on field trips, playing basketball in that varsity basketball team, or acting in a school play as some examples. School nurses and administrators should work with the families and the student to reasonably support daily diabetes management activities. And that's why those written plans are so critical. The foundation, as I know most of you are familiar with, this is a template of the American Diabetes Association Diabetes Medical Management Plan. We recently updated that plan. It's actually now 5 pages long and not 6 pages long, which I know still sounds a bit overwhelming, but it's just so comprehensive and will better enable the providers to provide direction for that individualized care. So this plan is now available online. The plan was revised to align with survey responses we received a little bit over a year ago from school nurses, providers, and parents. So we really took a hard look at those survey responses and we revised the plan. So this plan is for free. We're working on ways that we're hoping we can have it integrated with electronic health records. So that's in the future. We're also going to be doing a school nurse brown bag on the DMNP. I believe it is June 3rd, but don't quote me on that. But that information is on the website. So there will be opportunities for you to learn more about the DMNP. But as you know, the DMNP is completed by the child's provider. It's individualized for the individual student with diabetes. And it is the foundation for the 504 plan and all the written accommodations plans. So it's just a critical document. There are federal legal protections that provide protection for students with disabilities, and diabetes is a disability under federal law. So these are the main federal laws that provide these protections. Section 504 of the Rehabilitation Act of 1973, and that's where from which the development of the Section 504 plan flows, the Americans with Disabilities Act and the Individuals with Disabilities Education Act. And just quickly, Section 504, institutions with legal obligations to provide accommodations include public schools and private schools receiving federal funds. All of these institutions have legal obligations to provide services under the Americans with Disabilities Act, and going back to 504, religious institutions receiving federal funding also have obligations to provide services under 504. And then the Individuals with Disabilities Education Act, that's where schools are required to provide services to children with disabilities whose disability interferes with the ability to learn or academic performance. So these laws are all a little bit different, and you can find more information about these laws and their applicability and relevance to diabetes on our website, diabetes.org/safe at school. In addition to federal laws, we know there are state and local laws. For example, every state has its own Nurse Practice Act, and as part of that act, part of that law, there are delegation requirements and prohibitions, and in some states there are a lot of gray areas with that. But again, on ADA's website, we have a very comprehensive summation of the state laws for each state and their relevance to the provision of diabetes care at school. State and local laws will set forth provisions that permit self-management for capable students, prohibit diabetes schools. In other words, a student cannot be sent away from their neighborhood school to another school that perhaps has a full-time school nurse or other trained personnel, just because the neighborhood school does not have a full-time school nurse. The care must be provided at the child's regularly assigned school. So some of the states include these prohibitions in their laws. I'm sure you all have seen there's new statute for some of the states providing that schools can obtain undesignated glucagon. This means that schools in some states can obtain a prescription for glucagon to have on hand in the event that a child with diabetes who has orders for glucagon and perhaps their kit is expired, or the kit, for whatever reason, didn't get brought to school, that there would be, the schools would be permitted to maintain an inventory under these laws, and you'd be able to administer the glucagon, and the non-clinical staff, depending on your state, would be allowed to administer undesignated glucagon. And also, has been in the news, many of the states are passing laws that restrict a student's ability to access their cell phone. But as far as we can tell, and we've been monitoring and providing input to these laws do contain exemptions for students to be able to access their phones or smart devices to manage their medical conditions, such as diabetes. And for more information on laws and legal protections, I have the URL provided here. This is ADA's template 504 plan. We've recently updated it to include some of the new technology and the cell phone restrictions. We do recommend to parents that they do include a provision in the 504 plan that makes it clear that their child will have access to their cell phone to manage their diabetes. Benefits of having a 504 plan, and the school nurse is an integral part of working with the family and the school administrator and others on that 504 team to develop a 504 plan. But the 504 plan helps to clarify roles, responsibilities, expectations for the student, the family, the school, validates a health condition for the student, and lays out what the student needs in order to optimally function during school-related activities, and also, helping to ensure student success. The 504 plan is a formal process for determining how needs will be met, and it also provides redress and resolution if needs are not met. The 504 plan provides students and the family with the comfort in knowing the student will be safe and treated fairly at school. So It's really important for the family and the schools to work together to create an individualized plan. We know that every student is different, and what works for one student with diabetes may not work for another. So you may have a couple different situations at school, but your input and role in the development of the 504 plan is absolutely critical. So what are some examples of 504 accommodations? To provide a school nurse or trained non-clinical staff on site, including field trips and other school-sponsored activities, provide Wi-Fi access, and allow the student with diabetes to have access to their cell phone, permit capable students to self-manage their diabetes, and also for the school nurse to support that gradual transition to self-management. There may be some point during that transition where the student can perform some of those diabetes care tasks independently, but may need help from you with other diabetes care tasks because it is a gradual condition. Allow time to make up assignments and exams if they were missed due to high or low BGs, or if the student um, has to be away for a doctor's appointment or illness. We want our kids to always have bathroom and access to water. We want full participation in all school-sponsored opportunities, and also schools to provide CGM remote monitoring access as needed by the individual student. And again, that's an individual determination. The association has a wealth of school resources for school nurses. A lot of you are familiar, I know, with this 19-deck curriculum that was first developed by ADA back in the early 2000s, and we go back in and we update it once or twice a year. But this is a free PowerPoint curriculum that you can use to train unlicensed personnel. There are the slides, there's speaker notes, there are pre and post tests for these slides. So you have free and easy access to these slides. Also, we back in late 2023, early 2024, we made available a 7 webinar series that you can access now by clicking on that URL. And I think Abby's going to put that in the chat box for us. These are free 1-hour webinars on a variety of diabetes and school-related topics, whereby you can receive 1 hour of free CEU credit for each webinar completed. So I really encourage you to check that out. So some of the key takeaways before we go off to Q&A: children with diabetes increasingly rely on diabetes devices, which require access to cell phones. Individual care plans should be in place for each student. The school nurse or trained personnel should always be available during the school day and at school-sponsored events. Federal and state laws apply to children with diabetes so that these kids do have access to care and are protected from discrimination. And the school nurse is well positioned to support and advocate on behalf of the student. And the ADA has a wealth of resources, and they're free. And we're constantly adding to these resources, and we're constantly updating. And we welcome your feedback, and those resources can be found here at diabetes.org/safe@school. If you have need information or have questions, or you have parents who need information or have questions, we do encourage folks to contact ADA at 1-800-DIABETES. We have a legal advocate who reviews all of the intakes and will respond with extremely comprehensive and helpful information. Also, we invite you to join ADA's Healthcare Professionals Legal Advocacy Network. This will keep you up to date on what Safe at School is doing, new resources, new developments, just a wealth of information, and also will enable us to reach out to you for feedback from time to time. So there's a QR code you could scan in. So we'd love to have you join this free network. And with that, I am going to stop sharing and look at the chat box to see what questions we have. Let's see, I'm wondering if there are any programs that will help families pay for monthly data to keep CGM readings and other technology. I'm sorry, I am not aware of anything, but I think that's an excellent question, and I'm going to make a note of that and find out, Nicole, and we will incorporate that with the information on our website. But I think that is just an excellent question. It would be very helpful information to have. Let's see what else we have here. Oh, is this going to be recorded? Absolutely, it's going to be recorded. And I'm hoping to have it up on our website probably tomorrow, maybe not till Monday, but it'll be up there. And we have 3 more of these we're doing, at least 3 more we're doing between now and the end of the year. And we'll post those as they're recorded, so you'll always have them available. Let's see. Sorry, I'm just going down the list here. Is there a requirement per school on how many trained professionals there are per building? A parent stated that there must be a minimum of 3 trained professionals per building. It really depends on state law. There are some state laws. I know for Virginia, for example, has a state law that requires a minimum number of school personnel to be trained. So just check with state law, and you can get to those state laws again on our website. That information is all there for you. Our school nurse is the only staff that is signed off to administer insulin. We've had 2 days where I had to pick our little guy up because nurse coverage wasn't coordinated appropriately by administration. Does this go against ADA? And I guess by that you mean, does it go against the Americans with Disabilities Act? Assuming that the child is in a public school or in a school, even in a school receiving federal funds or in a non-religious private school, that school does have obligations under the Americans with Disabilities Act and/or Section 504 to make sure there is someone on site to give insulin. So I hope that helps. Again, you can read more about the laws. Let's see what else. We provided a food scale to help our nurse weigh food as needed for additional snacks provided by the school, but we received, let's see, why is that jumping around for me? I'm sorry. Sorry, I am having trouble. We see pushback from the administration stating they aren't a medical facility, so they won't use it. Is this an appropriate request as it's part of our daily management? That's a great question. I think that you probably, need to work with food service to make sure the appropriate portions are being made available to the children. I am not familiar with a food scale ever being provided, but I do think it is reasonable to work with the school to make sure that an appropriate portion is allotted. And I'm not sure how to best do that. Not a dietitian, but that's something it sounds like you could certainly work with the school nurse and the food manager to do. Where is the website for the webinars? That's diabetes.org/safe at school. In our region, staff in schools have been resistant to getting UAP trained for needs while the school nurse is at its school. What safeguards does a UAP provide to the person being trained to the school? How can we encourage staff to get this training? Staff say they do not want to be liable to care for these students. Actually, I am not aware of many school districts who do not have trained staff. I just think look for those staff who have a connection to folks with diabetes. Maybe they have a family member, maybe they have a child. Seek out those people, have them be trained. The state law provides immunity and liability protections for the school nurse, the schools, and the trained personnel. So take a look at your state's statute to see what protections are there, and also consult with your school board and school district attorney. But in those states, I can tell you there are 35 states that do allow trained non-clinical staff to provide all aspects of diabetes care, including insulin administration, and those states are on our website. So we do encourage schools to train non-clinical staff because, as I said earlier, most schools do not have a full-time school nurse. And even in those schools who are lucky enough to have a full-time school nurse, the school nurse cannot be in all places at all times. And we know that school nurses take days off. We know school nurses have kids too and maybe out sick. So I can't stress enough how important it is to have a plan for backup care at school for kids with diabetes. Do all students with diabetes, are they supposed to have a 504 plan? The American Diabetes Association recommends a 504 plan, an IEP, or other written accommodations plan for all students with diabetes. It might sound a little confusing, but under the current Section 504 regs, a written plan is not required. We're hoping that that will change eventually, but just because there's no written plan does not mean the child is not protected under 504 and that the school doesn't still have those obligations under federal law to provide the care. But it's always better to have a written plan, spell out the accommodations in writing, clarify the responsibilities, who's going to do what, work as a team, the parent, the school nurse, the school principal, 504 coordinator, teachers, the student as appropriate, work together to figure out what should go in that 504 plan. It's not, it's not a unilateral document. It requires a team effort in cooperation and support from many, many stakeholders. So yes, ADA does recommend that all students have a written accommodation plan. Let's see. Do you have updated info on how to legally and safely treat hypoglycemic students? That is in our curriculum. We're also working on a resource, a new hypoglycemia flowchart that will soon be available. But take a look at the slide deck. I think that's probably one of the best sources of information for recognizing and treating hypoglycemia. Okay, and hyperglycemia as well. Let's see. Someone said that they found insulin pump companies are happy to work with the school nurses, and that's been our experience too. So just reach out to those pump companies, and if you have trouble identifying who that representative might be, work with your students' parents and their diabetes, their endocrinology practice to identify who the best person would be to come in and do a training on the pump, on the CGM. Oh, any suggestions for a parent who refuses to bring in the DMMP and supplies? Um, I think, you just need to keep reaching out to the parent, reach out to the child's diabetes provider, perhaps, raise it up the ladder, have the administration reach out to the parent. Um, I'd be curious to know what the reasons are as to why the parent is not bringing the DMMP and supplies. Is it a financial issue? Is it a time issue? What is it? And just do the best you can. And I know you all are doing the best you can every day, but just doing the best you can to work it out. If a parent wants a 504 for their child, they do qualify diabetes as a disability. Yes, absolutely. Diabetes is a disability under federal law. And it's true. It need not be shown that learning or education is impacted in order for a student to qualify for services under 504. So we are at 12:31. We're actually a little bit over, so I promised you that this would just be a half hour. So I'm going to sign off here. This webinar will be recorded and available on our website very soon. I appreciate your taking the time to attend today. Please check out the other webinars that are going to be coming up. As I said, that DMMP webinar is going to be coming up in June. Janet Rodriguez, a pediatric diabetes educator and technology extraordinaire, will be doing that webinar in June. So I hope that you all will come back and join us. And thanks for all you do, and have a wonderful day.